Let's welcome Dr. Shah to the stage.
Thank you for that amazing introduction. Welcome tonight. It's going to be very special. I'm Shah. I'm a radiologist at Steinberg Diagnostics, and I've been at Steinberg for 16 years now. I did my fellowship in women's imaging, and although I read CTs and MRs and everything, I am most passionate about mammography, and that's why I'm so excited to talk to you tonight about it, especially our newest technology, which is tomosynthesis and 3D mammography. So I'm going to stand over here so you can see my screen. This is very informal. If you have any questions as we're going through, please raise your hand. I promise to make this really short. I know we've got a great production coming up, so feel free to interrupt me if you need to. If you have any questions, again, please feel free to stop me. So just to start, several facts. 40% of patients have dense breasts. That means that if you have dense tissue, you have dense glandular tissue, you're going to have more of a chance of getting breast cancer. That's unfortunate, but it's true. And while it's common, it's not abnormal, but it's something to think about in women, especially when they're younger. They do tend to have denser breasts. Fact number 2, it's more difficult to detect breast cancer with 2D mammography if you have dense breasts. That's because breast cancer looks white on a mammogram, and glandular tissue looks white on a mammogram. So it's very hard to see the contrast or the difference between the two when they're both on top of each other. So what does that mean? Well, that means we have more callbacks. So if you come in for a mammogram and I see something that I'm concerned about, I'm going to call your doctor or notify you somehow that you need to come back for additional views. And that's a lot of anxiety for a patient. They're going to be worried they have breast cancer. They're going to be scared that there's something wrong. Some patients decide they're not even going to come back because they're so worried about the results. It's also more expensive. It's also more exposure to radiation. You're going to come back and get additional pictures. So that's all something to think about with 2D mammography. So how is tomosynthesis going to help us with those two problems? How is tomosynthesis going to make life better for everybody? Well, one of the most amazing things about this new technology is we're able to see 41% more breast cancers in patients with dense breasts. So think about that for a minute. We're able to see 41% more breast cancers. So that's an amazing advancement in mammography that I don't think has ever been, it's been amazing. It's just great. So I think I'm so happy to tell you all about it because it's so incredible. And on top of that, it also, we decreased the amount of callbacks by 80%. So I'm able as a radiologist to make a more confident decision based on your mammogram. So I don't have to call you back. And I don't have to cause that anxiety and worry that most patients are going to go through. How does it work? So 2D mammography, and many of you women here have probably had a mammogram, you know that we take 2 pictures of each breast. So we have 2 images. With 3D mammography, we're actually taking about 40 to 80 pictures in that same amount of time. So it's amazing. It's like you're getting a CT scan of your breast because we're able to take slices of your breast tissue and image them in individual 1 millimeter slice sections. So we're able to see in front of dense tissue, we're able to see behind dense tissue, so we're able to get a much better look. Next slide. I don't know how well this is projecting, but here's a 2D image on this side. You can see the white lines here. That's going to be your glandular tissue. The blackness in the background is going to be the fatty tissue. So here you have a 3D mammogram on this side, and you can see I'm showing you only 3 slices out of about 40 or 80 that I would have. And the red circles are around the areas that are breast cancer. And you can see that same area over here, you can hardly see it. But on this image, you can see it so much clearer. So I know it's kind of a subtle example, but to a radiologist, this is a huge difference. Let's do the next slide, please. So again, this is not projecting beautifully, but just ignore these little white spots here for a minute. Those are benign calcifications. What I'm going to do here is actually run the 3D image. So as I'm sitting down as a radiologist, I can actually go through the slices of tissue and actually see the breast cancer pop right out. So it's an amazing advancement in our ability to see breast cancers, and you can see the cancer much more clearly. Is all 3D technology the same? No, it's not. There's many vendors that sell tomosynthesis, and we happen to have the Sun & Claire system from GE, which is amazing. one reason that it's so amazing, next slide please, is that it's the same radiation dose as a 2D mammogram. So it's not going to be any more radiation to the patient, which is great. I mean, we don't want to give patients radiation if they don't need it. The other vendor is the Hologic Genus system that's here in Las Vegas. That has about 2.4 times more radiation than the 2D mammogram. And that may not seem like a lot, but over the course of a lifetime, if you're getting a mammogram every year, that's going to add up pretty quickly. So that's one reason why Steinberg bought the GE system, because we were very concerned about the radiation exposure to our patients. Does insurance cover 3D? When we first started and introduced 3D mammography, very few insurance companies covered mammography and tomosynthesis, but as of now, we actually have 28 plans that cover it. So it's growing, and I believe in about 5 to 10 years, this is really going to be standard of care. I think every woman should have a 3D mammogram. So how do I get a 3D mammogram? Well, patients, you can request a 3D mammogram at the time of service, or you can have your physician indicate on your referral form that you would like a 3D mammogram, and it's very easy to have done. Next slide, please. Why 3D at Steinberg? Well, we have the GE Santa Clara, and we're the only facility in Las Vegas that has that. We have it at all 7 of our locations, so it's going to be easy to be accessible to everybody. And tomosynthesis is read by an imaging specialist. We have 10 radiologists that are trained to read tomosynthesis. You have to go through a certification, and you have to show competency and have read many mammograms. So that's my information for you. If you have any additional questions, I'd be happy to answer those.
Ladies and gentlemen, help me thank Dr. Shah.